Costochondritis, also known as chest wall pain, costosternal syndrome, or costosternal chondrodynia, is an acute and often temporary inflammation of the costal cartilage, the structure which connects each rib to the sternum at the costosternal joint. The condition is a common cause of chest pain. Though costochondritis often resolves on its own, it can be a recurring condition that can appear to have little or no signs of onset. Treatment options are quite limited and usually involve a combination of rest, analgesics, or anti-inflammatory medications. Cases with intractable discomfort may be managed with cortisone injections, or surgery may be indicated if the condition is severe. Individuals with costochondritis are typically instructed to avoid strenuous physical activity to prevent the onset of an attack. Costochondritis symptoms can be similar to the chest pain associated with a heart attack. Unexplained chest pain is considered a medical emergency until life-threatening cardiac issues can be ruled out. Severe cases of costal cartilage inflammation that also involve painful swelling are sometimes referred to as Tietze's syndrome, a term sometimes used interchangeably with costochondritis. However, some physicians view costochondritis and Tietze's syndrome as separate disease states due to the absence of costal cartilage swelling in costochondritis. Signs and symptoms: pain or tenderness to palpation usually occurs on the sides of the sternum, affects multiple ribs, and is often worsened with coughing, deep breathing, or physical activity. On physical examination, physicians will inspect and palpate the patient for areas of swelling or tenderness and can often reproduce the pain associated with costochondritis by moving the patient's rib cage or arms. A factor that may aid in the differentiation of costochondritis from Tietze's syndrome is the location of the pain on the sternum. Costochondritis typically affects the third, fourth, and fifth costosternal joints in contrast to Tietze's syndrome, which usually affects the second or third costosternal joint. Pain from costochondritis typically resolves within 1 year. Causes: in most cases of costochondritis, no cause is identified. However, costochondritis may be the result of physical trauma, associated with scoliosis, ankylosing spondylitis, rheumatoid arthritis, osteoarthritis, or a tumor. Infection of the costosternal joint may cause costochondritis in rare cases. Most cases of infectious costochondritis are caused by actinomyces, Staphylococcus aureus, Candida albicans, and Salmonella. In rare cases, Escherichia coli can be a cause of infectious costochondritis. Pathogenesis: the pathogenesis underlying the development of costochondritis remains unclear. Proposed mechanisms of injury include neurogenic inflammation, muscular imbalance, increased muscular pull on the rib, mechanical dysfunction at the costotransverse joint of the rib, or a derangement of the mechanical structure of the costochondral junction. Differential diagnosis: other causes of chest pain similar to that produced by costochondritis may include, but are not limited to, the following: cardiac, heart attack, pericarditis, myocarditis, aortic aneurysm. Gastrointestinal, gastroesophageal reflux disease, gastritis, esophagitis. Musculoskeletal, fibromyalgia, rib fracture, ankylosing spondylitis, bone metastasis from cancers such as prostate cancer, breast cancer, plasmacytoma, and sarcomas, reactive arthritis. Cytogenic, anxiety disorder, panic disorder, hyperventilation. Respiratory, pneumonia, pneumothorax, pleuritis, pulmonary embolism. Other, herpes zoster, drug abuse, multiple myeloma. Treatment: costochondritis may be treated with physical therapy or with medication. Treatment may involve the use of non-steroidal anti-inflammatory drugs such as ibuprofen or other pain relief medications such as acetaminophen. Severe cases of costochondritis may call for the use of opioid medications such as hydrocodone or oxycodone, tricyclic antidepressant medications such as amitriptyline for pain from chronic costochondritis, or anti-epileptic drugs such as gabapentin may be used. Oral or injected corticosteroids may be used for cases of costochondritis unresponsive to treatment by NSAIDs. However, This treatment has not been the subject of study by rigorous randomized controlled trials, and its practice is currently based on clinical experience. Rest from stressful physical activity is often advised during the recovery period. Epidemiology: Costochondritis is a common condition and is responsible for 30% of emergency room chest pain-related visits. 1/5 of visits to the primary care physician are for musculoskeletal chest pain. Of this, 20% of primary care office visits, 13% is due to costochondritis. Costochondritis cases are most often seen in people older than age 40 and occurs more often in women. See also, costochondral cartilage, references. External links: mayoclinic.com, benign tender chest wall pain of costosternal joints, inflammation at patient.co.uk, costochondritis and Tietz syndrome.